Hi, I'm Kevin Hill, and I'm a pediatric cardiologist here at Duke. I'm one of the interventional cardiologists, which means that I do cardiac catheterization procedures on children. There are a lot of different reasons that children might need a catheterization procedure. One of my specific areas of interest is pulmonary hypertension. Having children of my own, when they've needed medical care, you realize what an anxiety-provoking experience it is for families. Even the little things, like when my child has needed a dental procedure, going through that process is a very nerve-wracking experience for me. And so I think understanding what the parents are going through is very important to what we do. I think I'm somebody who likes to not create excess anxiety. I think parents are always anxious enough about the process. There are some physicians who perhaps like to emphasize the bad things that could happen. For most of what we do, things turn out very well and our patients do really well, and I like parents to understand that before we go into them. We always talk to our parents about the risk of the procedure that they're about to go through, but I think almost everything that we do is done very safely. We have a lot of experience doing the things that we do, and so I don't think parents need to be overly anxious or any more anxious than they already are. I think one of the most important things we offer for our families is we're entirely pediatric. Our staff are all pediatric cath lab nurses. The people who do the interventions in the cath lab do nothing but pediatric cardiology. So that's reason number one. I think that's really important. You get a real pediatric, children-centric experience when you're coming to the cath lab at Duke. I grew up in South Africa, and my father was a physician, and when I was growing up, I was often in the hospital with him. Every Christmas we would go to the hospital and see all the children. So I think from a young age it was always something I considered. I loved seeing what he did and being around the children and seeing how they got better when he took care of them, seeing how much he helped some of them. So there was definitely that component. But then as I got older and got into college, I was also fascinated by the science behind medicine and the ability to really impact the lives of children by advancing care in sort of a cutting edge fashion as well.